Welcome to our lecture on injuries. So the reason that we're so concerned about unintentional injuries is that in 2016, more than 4.6 million people died of an unintentional injury worldwide. It's common in the cause of death of 8.4% of the population. And for the cause of disabilities, it happens to be about 11%. So you can see actually more people have disabilities related to unintentional injuries versus deaths related to unintentional injuries. So an injury is the result of an act that damages, harms, or hurts. But an unintentional injury is a subset of injuries for which there's no evidence of predetermined intent. Common unintentional injuries are road injuries and other transport injuries, poisonings, falls, fires, drownings, animal contact, exposure to forces of nature, exposure to mechanical forces, adverse effects of medical treatment, and those other unintentional injuries that are not classified here. The largest cause of unintentional injuries globally are road injury, poisonings, falls, fires, and drowning. If we look at globally, about 6% of the total deaths are attributed to injuries in high-income countries compared to 9% in low-middle-income countries. And in low-middle-income countries, women are far more likely than men to die from fire. So when we're thinking about deaths. So let's look at the burden of unintentional injuries. Let's look at high-income countries. Well, the highest ones are road injuries and sorry, that should have been falls. It should have been up a little bit higher. So falls and road injuries. And you can see that, look at the difference between males and females. 92 versus 35 females die from in high-income countries, die from road injuries. So the other falls is about the same, but the death rates for injuries from road traffic accidents is more higher in males. What about upper middle income countries? So again, there's a high rate of falls. Actually, males versus females is a lot higher, probably because of the work. And road injuries is a lot higher. So 428 in males and 129 in females. So really, you can see how the road injuries have really ratcheted up as we move to middle income countries, upper middle income. If you look at lower income, it's about the same. You still have that high rate of falls and a high rate of road injuries. And then lower income countries, again, you still have that high rate of road injuries and the falls. And then you have coming in are the others, what I'm not sure about, but then the fires are coming in and the drownings are coming in those low income countries. The majority of childhood injury deaths occur in low and middle income countries. If we look at road traffic accidents, 3 times as many men die in road traffic accidents as women. The number of people who suffer disability annually is greater than those who actually die, and we've discussed that. And if we look at the age burden, it looks like the age cohort from 15 to 49 and 5 to 11 have the highest rate of death due to injury. So the infant, young adult, pediatric kind of clients. And if we look globally at age groups, if we break them down, again, road injuries are the highest. So road injuries are the leading cause of injury death among children, adolescents, and young adults. And then if you look across, you can see the other, so drowning is coming up second in the children age 5 to 9 and 10 to 14. And then as we get up a little bit higher, you have interpersonal violence happening in that teenage years, so risk of suicide. And then the other later on the rankings, conflict and terror are in the kind of rank 4 and 5. So the most common cause of injury-induced deaths among these age groups are road traffic accidents, drowning, conflict and terror, falls, interpersonal violence, and self-harm. So what are the risk factors for young children? Well, they have developmental immaturity. Poverty has a huge influence on the ability of parents to provide adult supervision and childcare. exposure to unsafe workplaces, and it's mostly associated with physical activity and varies with socioeconomic status. If we look at road traffic injuries, there's an increasing number of motor vehicles in low middle income countries, but they don't have the road traffic regulations to go along with it. There's a lot of use of two-wheeled vehicles, but especially without the use of a helmet, so motorbikes, mopeds. Insufficient attention is paid to road planning, designing, engineering, signage, or traffic management. So that's the big issue, is that increasing number of motor vehicles, but not that road planning to go along with it. And there are many unsafe vehicles that lack an airbag or safety belts. And so these are the increasing the risk of road traffic injuries in low middle income countries. The costs and consequences, well, the direct costs obviously are medical care, hospitalization, rehab, and funeral services. And indirect costs are the loss of wages, sick leave, disability payments, insurance payouts, and costs associated with family care. Also, WHO estimates that in 2006, the direct costs due to road traffic injuries alone were about $500 billion annually. And there's a lot of other costs, the psychosocial consequences such as post disability fatigue or post injury fatigue, so chronic fatigue syndrome, memory loss, changes in work status, and altered family dynamics. So one tool that's been used quite a lot to look at prevention and control efforts is Hayden's matrix. And so this matrix was developed and used in injury prevention, especially in road accident research and public health. And so it's a matrix that's divided into these 9 cells, and it looks at the interaction of the host, which is the human, the vector, which is the vehicle or equipment that was involved in the accident, and then the environment. And it looks at the phases of the accident. Was it pre-crash, crash, or post-crash? And what you would do stepping back is you would look at these different boxes and fill in what are the factors that led to this pre-crash that we could actually develop interventions for. And so it has a real strong focus on prevention and prevention measures, and it focuses on education, enforcement, and engineering efforts. So example is road traffic injuries. So the environment could be the roadway, the vector is maybe the driver, so the vehicle, so the vector is what the individual is driving, and the host is the human driver and the behavior. Was the individual under the influence? Are they at an older age? Can they see well enough? And so possible intervention is that you could look at the environment and make the roads safer by improving high-risk intersections and routes, improving medians, enhancing lighting. You can make the safer vehicles by ensuring that engineering safety measures are in place. And the other thing that you can do is enforce the speed limits and use of helmets. And one area that we looked at, or that was looked at with humans in this pre-crash crash, is looking at changing the license to be a graduated licensing now. So looking at those changes. When you turn 80 years old, you need to redo your written test, and you have to demonstrate that you're a safe driver. So looking at things like that. And if we look at poisonings, addressing those key issues of educating families to store poisons and other household goods out of reach of children, to store them in appropriate and marked containers, and to enforce rules that prohibit the sale of poisons in unmarked and inappropriate containers. Now, we don't see this in Canada, but definitely you would see this in low middle income countries. And so, stepping back, what are some of the key issues that need to be addressed? Well, the importance of raising awareness about how to apply rigorous methods of prevention and control, so helping low middle income countries with that. Having a formal surveillance system to provide information on the numbers of individuals with unintentional injuries and the patterns, because you saw when we looked at the numbers for low middle income countries that they didn't have the higher numbers that we saw in high income, but they probably have just as many injuries, is that they're just not statistically accounted for. Implement minimum standards and develop the local capacity to analyze the data and design programs specific to the setting. Other ideas are that the most cost-effective efforts to reduce injuries is to develop the most cost-effective efforts to look at those injuries that are high. So falls, drownings, and fires. And you can look at that from a community-based effort. For falls, information should focus on the specific risks to the elderly and children. And for drowning, information should focus on increased supervision and covering wells. A lot of children die in open wells. So the future challenges would be ensuring that low middle income countries have the political commitment needed to reduce the burden of unintentional injuries. So is that need there from the political leaders? Integrating lessons learned from high income countries, engineering safety into newer roads, and increasing the knowledge of injury prevention. So the main messages are that injuries are an important cause of death and DALYs in all regions of the world. Injuries account for more than 8% of the total deaths globally. Road traffic accidents are the leading cause of injury attributable to deaths and DALYs. Hayden's matrix is the theoretical foundation of many injury prevention and control efforts. Reducing the burden of injuries will require enhanced community-based approaches, including community-based child care centers, creating rumble strips and speed bumps, truck driver first aid training, and improve emergency transport services. Lastly is thinking about those emergency medical services for low middle income countries. And you need to think about something that's low cost but effective. A couple ideas or things that must be considered is that the vehicles must be equipped for low income or rural communities because of the roads. There needs to be truck driver training to provide first aid and transport, and also training healthcare personnel who work in emergency situations would be the other context in low middle income countries.